going to walk you through casting from all the supplies you need to putting it on the patient and letting them go. So the first thing you need is a casting stand for the patient to put their foot on. Cast padding, 3 inch is preferred. A stockinette, also 3 inches preferred, but depending on bigger patients you might need 4 inch. 3 inch casting material, so 3, 3, and 3, it's easy to remember. Scissors, a chuck, a bucket for water, and 2 pairs of gloves. Once the patient is sitting, you'll want to put the stockinette on their foot first. And you want to take about a length that goes from your hand to your armpit. That's about the right length that you'll need. So when putting the stockinette on the patient, you want to roll it tight in your hand. You have to remember that this individual is coming out of either surgery or a recent injury, so they're going to be pretty sensitive down there, so you want to take care when rolling it up their leg. Some patients will try to help you, like mine is doing here, by putting your leg out, and that's fine, but if you find it distracting, you can just ask them to bring it back. You want to have enough room past the toes, so you might have to pull a little bit on it. So when you are done with the cast, you can roll it back. And same above the knee. You want your cast to go at the tibial tuberosity, right about here, so about 2 fingers below where their kneecap would be. Okay. Then you take your cast stand and you're going to tell the patient that you're going to be sliding it between the sock and their foot, and it's going to rest back on their heel. Now you don't want it all the way back, but you also don't want it in front of their calcaneus because it can get really uncomfortable really fast for the patient. One really important thing is that their foot and their knee is both at 90 degrees. So you can take a look at that. If you need to ask the patient to come a little bit forward, you can, or you can adjust your stand. You probably have to do a little bit of both. Another key thing for doing a cast is to make sure you don't have any wrinkles in the cast. You start with the sock first, obviously, since it's your first point of contact with their leg. And what I will do is gather at the front of the ankle and cut a piece off right there, just to get rid of that wrinkle there. You can just cut some off the side, and they'll be fine because they'll have cast padding to cover their skin before you put the casting material on. So we'll cut like that. You can just fold it over there. So her foot is doing something a little weird here, where it's giving me a little wrinkle here. So I'm going to actually pull a little more and probably take a little bit more off of it. Actually, I'm going to have you pull your foot back just a titch. Perfect. So let's smooth that out there. Make sure that's nice and flat. And now you're ready for the casting material. So at this point, I'll tell the patient to stay really still and keep this position that it's perfect, and that's how we want their foot to be. When putting the cast padding on, you want to roll it so it is rolling in this direction, not like this. And when you roll it, you want to be very close contact, right along. You don't want to pull and then try to wrap around. So this casting material will tear really easy, and that's what you want to do, because you want to do small little strands so you're constantly getting close contact that's nice and smooth. You want to do 2 layers around their forefoot here and around their ankle here, especially if they have a really prominent malleolus on their medial and lateral side. So you'll overlap the padding just enough, especially on the top, that it covers the crosses to where you went. And then from there, you'll just do a single-ish layer up the leg. The heel, you'll do a straight up from the bottom. See how easy that tears? I just pull. Now I'm using my hands a lot. I don't count on just my vision here to see if it's smooth. I feel around to make sure there's no weird things poking out. I feel something on this side, so I'll just give it a little pull and make sure I keep it smooth. And I'll come at an angle, so I'm coming at a 45-degree angle towards me. Again, making sure it's smooth. Using my hands to feel for everything. If there's any flyaways, I just gently pull on them, and they'll come, smooth it down, and then coming straight at me, 90-degree angle at the back of the heel. The front of the ankle, depending on the patient, can be a little hard. My patient here has a really tiny ankle, so we want to not try and wrap it around multiple times because then it'll just get lumpy. It can get really lumpy here really easy if you're not careful. Going up the shin, you'll cross the front of the tibia once, and then as you come around, you'll cross it again. because you'll want it to be nice and protected. And you want to do a slight downward angle, because as it goes down around their calf, it'll come back up. So you have this nice little fluff going on here. And you'll slightly overlap each layer as you go up. And then as you run out, you grab another roll and keep going. Now, a lot of patients will have a knee scooter, so I like to do more layers at the top so when they're putting their knee down it doesn't hurt them. And you want to do it a little higher than the tibial tuberosity, because when you fold down the cast, you don't have this fiberglass, which is what the cast material is, poking into their skin, which we'll see in just a little bit. So now that I've done one layer, I'm going to go back and do two. You only want to do 2 layers of cast padding, with 4 layers being, again, around the heads here of the metatarsals and around her medial and lateral malleolus and in front of the shin. So I'll do just the same as I did before. Again, using my hands, I can feel I have a rough spot there, so I'll just smooth it out. Notice how close I am to her foot. I'm not trying to like roll it out and come around. So again, with the heel, just to stress that, we'll start at the bottom, come up. And it's okay that this is a little long. I'll just use the last of the cast padding, because it's again covering the lateral medial malleolus. And I'll do the 45-degree angle towards me, again hitting those 2 bones. Again, using my hands to really make it nice and smooth. And a 90-degree straight over. And again, I'm just going to do a little piece on the front of her ankle. I don't want it to get too bumpy. And then it's up the shin we go. So close contact, I'm just rolling right along her shin here. Again, constantly feeling, making sure there's no obvious bumps or wrinkles. And then I'll probably just use, so sometimes you'll go a little bit down, and that's fine, especially at the top. And then you can just use whatever you have remaining if you have anything left. So really bring it all in. Get rid of those wrinkles. Next is the casting material itself. And this is why you have 2 gloves. I prefer to do the padding without the gloves because it allows me to feel easier, and the gloves, they interfere a little bit. It's personal preference. You can try it both ways. And then when you do the actual fiberglass part of the cast, you want to make sure you have cold water in your bucket. You can bring it as close to you as you need. The way that the cast material hardens is by contact with the air. So as it dries, it gets warm. So if you use warm water, it can actually make it dry a little faster. And as you're learning, especially if you're going a little bit slower, it gets really challenging if the material starts to get hard. My second pair of gloves, I don't pull up all the way because I want to be able to get them off without getting fiberglass all over me, as we will see shortly. So make sure my bottom layer is a little bit higher, because if this material gets on you, it doesn't like to come off easy. And if it gets on your clothes, it will never come off. Alright, so I make sure I get this nice and wet. Maybe get it a little squeeze so it's not dripping all over the place. And then same direction that I did the cast padding, this way, not this way. And this again is very close contact. And you just roll it along. Again, avoiding wrinkles and letting the casting material kind of guide you, but at the same time you're telling it what to do. If it really wants to go one direction, just go with it and then correct course later if you need to. Now I believe on the back I have a little bit of a gap, which I'll be able to fix with the next layer. It's not imperative that every layer be exactly on top of one another. In fact, you want it to be slightly staggered. So if you miss a spot on your first layer, it's fine. You can go back and correct it later on. Now when you get to the end here, it's folded over itself, so you just have to unfold it and tuck it around. Get a little bit of water on your hands and kind of rub the cast, feel for any bumps. If they're bumps, you can smooth them out. That's the nice thing about this material. And make sure that they are still in the direction. So I'm going to actually ask you to come a little bit forward, just a smidge. Perfect. Now, most patients require 3 layers. Sometimes you're going to have a patient that requires 4. It just depends on the size and the length of their leg. With this patient here, we're probably going to just do 3. So again, get this nice and wet and start at the bottom. You'll always start at the bottom. It doesn't matter if you run out of cast material here, you'll still start at the bottom. And again, you don't want to pull tight when you're doing it. You just want to roll it along, because as it gets hard, it will start to feel a little bit more tight, and you don't want it to be uncomfortable for the patient. So with this, I'm going to make sure I go back down around the heel again, and then allow it to go back up. Hands it again and smooth it out. So if this were my second to last layer, whether we're doing 4 or 3 layers, this is where things change just a tiny bit. So make sure everything is nice and smooth, make sure they're in the right position, really smooth the front of the ankle, the sides, and you don't want to squeeze into them because you don't want the cast to form too close that it's uncomfortable. You want it to be close enough that it's doing what's supposed to, but not that it's causing them to have any kind of injury, any kind of open sore underneath the cast, because that is not good. So now I have a sticky layer of gloves and I need to touch the sock. I don't want to get this all over, so I'll just go ahead and pop them off. Hence the 2 layers. And now that I'm at my last layer, I'm going to ask my patient, I'm going to tell her to pull slightly back as I pull this forward. Perfect. And get that out of the way. And then kind of smooth out where that bump was. Alright, just say, okay, you can go ahead and relax. I'll take the stockinette that I have left hanging over. I'm going to expose their toes. Make sure that's smooth, and I like to pull on the sides a little bit just to make sure the toes have some breathing room. There's a couple different type of casts where you will come further out, and it's called a fish mouth, and you'll do this type of movement with them. It's good just to practice on every cast because their toes like to be able to see the sun, because the rest of their leg can't. And then you'll pull down your top layer here, and you can pull a little bit more if you have that extra padding over the top, which will be a little bit more comfortable for your patient. This sock was quite long, but it's better to have too much than too little, and you'll be able to cover it with the cast padding. But you really don't need to probably go to there, so you'll figure out as you go along what is a proper amount and what might be too excessive. This is a lot because I have to try and get all these wrinkles now. Alright. Okay, back to the last layer, just like we did before. Nice and wet. And start the same place. I start a little bit back so you can see the stockinette. That way the fiberglass isn't going to snag on anything. And I'm rolling up the foot. I want to go ahead and capture her ankle one more time, just the back of the heel. And since I don't want to run out of padding, I'm going to kind of jump a little bit, or excuse me, run out of casting material. And the last layer is going to be the one the patient sees, so you want it to be aesthetically pleasing, because we're going to be in this thing for several weeks. And now this is the time you really smooth it out. Now is a good time as you're wrapping up with the patient to kind of tell them what to expect with the cast. Let them know that you're going to feel it get warm as it's drying, and that we want to keep you in the room here until it doesn't feel tacky anymore, otherwise it'll get on material, such as clothes or your scooter. And also, not to stick anything in the cast. You don't want them to scratch the surface of their skin or break the tip of a pencil or ruler off, which has been done. And to let them know that if they have an itch, they can take a spoon and tap on the cast over the itch. The vibration will help. And they've also done some studies that if you scratch that same spot on the opposite limb, it'll actually provide relief. That only works though if it's in a cast. It doesn't work with mosquito bites. So don't try that. And there is a lower limb cast.